You're already tired, bloated, got some morning sickness, and bam, hay fever hits. You go to reach for your trusty stash of antihistamines and then you remember, hang on, I'm pregnant. Should I really be taking this? In today's episode, we're going to cover all the medications you can use in hay fever if you're pregnant. At the end, we'll also go through some handy prevention tips. Let's get started. Hay fever, also known as allergic rhinitis, is an allergic reaction to allergens such as pollen, dust mites, and pet dander. The symptoms usually include sneezing, itchy and watery eyes, blocked, and a runny nose. In pregnancy, symptoms of hay fever can be increased by up to 30%. It's important to differentiate between hay fever and pregnancy congestion. Now, during pregnancy, it's really common to experience nasal congestion. During pregnancy, we have an increase in the levels of certain hormones in our bodies. These hormones can cause swelling and increase mucus production. Now, if you experience just a runny or a blocked nose, there's a high chance that it's just pregnancy congestion. If you also experience sneezing and itchy and watery eyes, then it's more likely to be hay fever. The most important thing to do if you experience hay fever is to avoid allergens. At the end of our video, I'll go through some prevention tips. But right now, let's go through some home remedies. The first home remedy is a saline nasal rinse. This is just salt water and can help to flush out mucus, allergens, and reduce inflammation. You can purchase them already made up in the pharmacy, or you can make it yourself. The second home remedy you can try is a humidifier. Running a humidifier at home can increase the moisture in the air. This can reduce dryness in the nasal passages and ease congestion. The third home remedy you can try is a steam inhalation. Inhaling steam from a hot shower or a bowl of hot water can provide some temporary relief of congestion. Now let's go through the medications you can use in pregnancy. Now, in regards to medications in pregnancy, it's always recommended to use them for the shortest period of time at the lowest effective dose. This just means if you don't need to take the medication and you don't have symptoms, then don't take it. Keep in mind that a lot of medications haven't actually been studied extensively. So when I say that the medications are considered safe to use, it may be that there haven't been a lot of studies on it, but it hasn't shown to have any negative effects on the unborn baby. Now, the treatments we choose for hay fever will depend on the symptoms and the severity of the symptoms. The treatments available come as tablets, nasal sprays, and eye drops. For mild general symptoms, and if you experience hay fever less than 4 times a week, then usually you would start with an antihistamine tablet or an antihistamine nasal spray. You take these only when you need it. An antihistamine is a medication that blocks histamine, which is a chemical that causes allergic reactions. There are 2 categories of antihistamine tablets: sedating antihistamines and less sedating antihistamines. The sedating antihistamines have been around the longest and have been studied the most during pregnancy. But unfortunately, they do tend to make you drowsy. The first-line antihistamine I would recommend is dextromethorphan. You can also safely use other drowsy antihistamines such as cyproheptadine, doxylamine, and promethazine. Using sedating antihistamines regularly near the time of birth may cause some drowsiness and withdrawal symptoms such as irritation in the baby. So it's recommended to take it only if required, especially towards the end of your pregnancy. You may also use some less sedating antihistamines. Loratadine is the first-line treatment out of the less sedating antihistamines. Fexofenadine, cetirizine, and desloratadine are also considered safe to use. Antihistamine nasal sprays are also considered safe to use as they're applied topically, and it's unlikely that much of the medication gets into the bloodstream. Some examples are levocabastine and azelastine. The nasal sprays are quick-acting and work within minutes. For moderate to severe symptoms, and if you experience hay fever symptoms most days, you can use a corticosteroid nasal spray containing beclomethasone or budesonide. These are considered safe to use in pregnancy. Decongestant nasal sprays, such as oxymetazoline and xylometazoline, are considered safe to use in pregnancy if you have a really blocked nose. Just keep in mind they can only be used for no more than 3 to 5 days in a row. For itchy and watery eyes, you can use eye drops. The 2 main categories of eye drops are antihistamine eye drops and mast cell stabilizers. You have antihistamine eye drops such as ketotifen, levocabastine, and phenyramine. These work quickly to get rid of the symptoms. You will often see a decongestant in combination with an antihistamine eye drop. The decongestant is there to constrict the blood vessels to reduce the redness that comes to the surface of the eye. They shouldn't be used for more than 3 to 5 days in a row. The second category are the mast cell stabilizer eye drops such as sodium chromoglycate. These work to prevent the symptoms, so it's best to start them at least a week before symptoms appear. Ketotifen is both an antihistamine and a mast cell stabilizer eye drop. Now, all these eye drops are considered safe to use as they're applied topically and not much actually gets into the bloodstream. Now, to minimise the amount that goes into the bloodstream, it's best to press the corner of the eye just like this for about a minute or 2 after you apply the eye drops. If you have hay fever, you quite often get eczema or asthma, as these are all related. These can often be passed through your genes to the baby. Did you know that if one parent has one of these conditions, there's a 25% chance that the baby will get it too? And if both parents have it, then there's a 50% chance that the baby will get it. There are some studies that show that taking probiotics during pregnancy can help to reduce the prevalence of eczema in the baby. So if you experience hay fever, eczema or asthma, it's a good idea to start those probiotics now. Now it's important to remember that this is just general advice, but make sure you speak to your healthcare professional. Medical information is always changing as new studies come out. Now let's go through some handy tips to help prevent hay fever. Number 1, keep an eye on the pollen forecast and avoid going outside when the pollen count is high. Number 2, keep windows and doors closed and use an air purifier or a HEPA filter to try and keep these allergens out. Number 3, keep your living space clear of dust and pet dander by dusting and vacuuming regularly. Number 4, don't hang your clothes and bed sheets outside, as pollen tends to stick to fabrics. Number 5, if you tend to get itchy eyes, then make sure to wear your sunglasses when you go outside to prevent the allergies from going into your eyes. Number 6, if you're going to areas where you know there's going to be a lot of allergens, such as outside, or if you're going to dust the house, then make sure to wear a face mask. Number 7, apply some Vaseline just to the inside of your nostril. This will help to trap the allergens to prevent them from going into your body. Now that comes to the end of our video. Thanks for watching, and if you have any questions, please leave it in the comments below. Now if you want to see more videos like this, don't forget to subscribe, and we'll see you next time. Bye!